Hello students, welcome to VHS e-classes and our today's topic is patient education. So let's start. So in this particular chapter, we are going to discuss about the patient education, what are the concepts of this, purposes of this, importance of patient education, and what are the various processes in patient education. And as a nurses, what's your role in this and how you will integrate this patient education in nursing process. So these are the chapter outlines. In this, we will talk about the introduction of health education, the concepts and importance of this, the patient education process, the role of nurse in the patient education, and how we will integrate it in nursing process. So first of all, what is this introduction? So as per Ginger, it was given in 1995 and he has given us three terms. Okay, so the first term was like patient education start with disease oriented patient education, that is DOPE. Another term he has done, that is he has given, is prevention oriented patient education, that is POPE, that is prevention oriented patient education. And the third one is health oriented patient education, that is HOPE. Okay, so these are the three terms given by Gruninger in 1995. So next is aspect of nursing. So there are following aspects of nursing. First one is spiritual aspect of nursing. So when an individual is physically unwell, the belief system of that particular individual is challenged. Okay, as we know, these are the aspects of nursing. The first one is spiritual, and here we have to provide spiritual care to the person. We have to meet the needs of spirituality of the patient. Okay, we have to help them to in the performance of the routines or ritual he has followed in their spiritual practices, or the purpose of this is to provide patient a support and to provide a feeling of hope and to relieve from the loss or pain. So that is spiritual, and this is the aspect of nursing, spiritual aspect of nursing. Next one is emotional. Okay, so emotional aspect is very important. It includes that the patient is an emotional being and we have to be very empathetic and compassionate towards our patient. Okay, we have to show empathy towards their sickness, towards their loss, towards their grief, or towards their pain. And we have to make sure that we are helping them to be emotionally stable and to process their emotions well. Next is social. So as we know, nursing is related to society too. Okay, so here we have to empower the patient's relationship with his or her society, and nurse needs to be free from any kind of judgment, any kind of bias, while she is providing societal care to the patient, or she is helping the patient to understand his or her society better. So it will help to resolve the conflict between patient and their society. So next one is physical. So this is very important aspect of nursing. Here we are providing the physical care to the people or to the patient. For example, hair care, we are providing back care to the patient, oral care to the patient. We are just assisting him or her in their daily activities of living. Okay, so these are all physical aspect of care, and this is a very important aspect of nursing. So these are the main aspects of nursing. One is spiritual. Here we have to provide the spiritual care. One is emotion. Yeah, here we have to help the patient to accept his or her emotions. Next is societal. Here we have to help the patient to accept his or her society. And next one is the physical care to the patient. Next are the concepts of nursing education. So there are following concepts of nursing education. It is basically divided into two. First one is clinical patient education, and the second one is health education. So what is clinical patient education and what is health education? The first one is clinical patient education. It is teaching provided to the patient during the course of treatment, that is in clinical setting. So whenever we will provide any education to the patient or any knowledge or awareness to the patient, but he is in the clinical area or he is in the hospital, that is clinical patient education. And whereas health education is provided when the patient is going to home or where the patient is living in a community area or in their home only. And the main focus of the health education is to to focus on the wellness, to focus on the prevention, and to focus on the promotion of health. So in clinical patient education, it is continuous process of teaching learning where healthcare team members as well as patient is involved. And here in patient health education, we provide them some additional information other than their healthcare teachings. Next one is in clinical patient education, the focus of treatment is assessment, diagnosis, treatment, prognosis, and meeting the needs of the patient. But in health education, the main focus of the care is prevention of illness, promotion of wellness, and it's also focus on the social health behavior of the patient. And in clinical patient education, the aim of the patient education is to help him making decision. Okay, so what kind of decisions? Right now, the patient is in clinical setting. So what kind of decision he has to make? He has to make the decision related to the treatment, the choices of treatment, okay, whether to carry out the treatment or not. So these kind of decision he will make with the clinical patient education. Whereas in health education, we will tell him about what is mandatory, what is not mandatory, and basically here we will tell them what they have to do after the discharge or whenever they are in a home setting. So these are two types of nursing education or the patient education. One is clinical patient education, another one is health education. Okay, so patient education, in clinical patient education, as we know, teaching is provided when the patient is in the clinical setting, and the best example of this is while the patient is making any decision related to his treatment intervention choices. At that time, whatever kind of information or health education we will provide to the patient, that is clinical patient education. Whereas health education focuses on the wellness, prevention, health promotion, and the best example of this is health education at the time of discharge or teaching about the prevention of complication after going home after the discharge. So these kind of educations are there: clinical patient education and health education. Next is the concept and importance of patient education. So patient education is always considered important in care, and it will help us so that the patient can improve his life, and it will help the patient to gain the maximum health. Okay, so what is the concept? In 1918, National League of Nursing Education in US identifies its importance, and they recognize that it is very important for the patient to educate them about the promotion of health and about the prevention of illness. And this is why today's nurse educator certification course is there to make sure that we are providing education to the people in the clinical settings or at the time of discharge. So what are the purpose of this patient education? To move the patient from fully dependent to the self-dependent. Okay, we will provide them health education so that they can help themselves, they can be dependent on themselves, and make the patient ready for his or her routine. Okay, next is to improve the quality of care. Yes, it will help in decision making, and it will also make patient aware of his or her duty during the time of his or her illness. Ensure the continuity of care. As we know, we are providing education to the patient at the time of discharge or in the clinical area. So it will help us to ensure that the quality of care is provided even after the discharge of the patient. And next one is to reduce the anxiety and clear the doubts of the patient. So health education will clear any doubt of the patient regarding the treatment or after he will go to the home. Ensure expected results of treatment with patient education and participation. So we will be ensuring that whatever the result we want, even the patient is not in the hospital setting, we are able to get those results with the assistance of patient. And it also promotes the compliance of the treatment or intervention. So if we tell the patient why it is important, how they have to follow particular medicine, what kind of follow-up routines they have to do, so it will help us to maintain the compliance of the patient with the treatment and help the patient in decision making, and it is very important. So when we will tell the patient how many types of treatments are there, which one is having advantages and which one is having different disadvantages, so it will help in proper decision making while the patient is in hospital setting or even in the home setting. So what is patient education process? As we all know, process is a sequence of planned events or the actions. So there is a patient education process. So there is acronym for that is assure. So it is given by Rega in 1993. That means A means analyze the learner's ability. Okay, so before providing education to someone, we have to analyze their ability to understand that. Next is set the objectives. We have to set some goals what we want to achieve, and we have to provide health education as per that. Next is select methods of teaching and resources. So as per the learner's ability, we have to select the teaching methods. Next is utilize whatever resources you have to teach the patient. And R means require performance of the learner. So here in health education, we need equal participation from the side of learner or the patient. And there comes the E. Evaluate the goals, achievements, and if not achieved, then the goal is set again. And in this case, goal achieved, the termination of the process is done. So last one is evaluation. Here we will evaluate that after the health education, have we met our goal or not. If not, then we have to teach them again, and if yes, then we have to terminate this particular process of health education. So this is the process of health education, Rega's patient education paradigm, that is assure is the mnemonic for this. So what's the role of nurse in this and what's the role of patient in this? The first one is analyze the learner's ability. So here the nurse will assess the learner's ability but without any judgment. And here patient's role is to verbalize his or her feelings, anxieties, weakness, doubts, etc. So that will be the nurse patient's role here. Next step is set the objectives. So what will be the role of nurse here? Okay, so here the nurse and patient will talk and they will have a mutual agreement that what they want to achieve. Okay, and the patient's role is dependent role. Here the patient will depend on the nurses and their expertise on the decision making. Next is select the methods of teaching and resources. So what is the nurse's role? Various options are there, and nurse's role is to make sure to select particular method that is good for the patient. Okay, it can be like demonstration, it can be with the help of videos, or it can be a verbal session for health education. Next, and the patient role here is partial dependent role, as involvement in decision making occurs about how to learn. Next is U means utilize resources and methods. So nurse's role here is to make sure that all the methods are utilized here, and there are various methods and she is utilizing all the skills, all the methods, all the activities, or all the resources available in the ward. And the patient role is also dependent here, and he will be dependent on the nursing personnel here so that he can overcome his anxiety and fears. Next is R. R require performance of the learner. Now the nurse, she has done all the teaching, she has demonstrated all the skills by the demonstration method or by the video method. Now it's the role of the patient to show the result, or it's the time when the learner will show what they have learned in this particular process. Okay, so that is require performance from the learners. Next is evaluation. So evaluation is when the nurse will ask some question related to the patient and his problem, and the patient will answer those questions. And if the patient is able to understand, we will terminate the patient education process, and if not, we will again set new goals for the patient. Next is clinical example of patient health education. So how we can do this? The first one is analyze the learner's ability. Here we will ask them different questions like, do you know how to inject the diabetic insulin, administer insulin at home from the diabetic patient? Next question we will ask that how your relatives know, do your relatives know how to administer this injection at home? Okay, so these kind of questions we can ask. Next is set objectives. So here in the case of insulin, for example, so here we can set the goal that we have to teach the patient how to administer this particular insulin injection. So method of teaching, obviously here we will use the demonstration. First we will demonstrate the patient how to inject it. Next is utilize the resources. We have to make sure that we utilizing all the resources and how the patient learning will take place. First the nurse will demonstrate the patient. After that the patient will redemonstrate the nurse how to inject it. Next is require the performance from the learner. That means patient will demonstrate how they will inject the insulin injection and what sites they can use here. And last one is the evaluation, where we will evaluate the goals that we have achieved. So what is the role of nurse in this patient education? The first one is nurse should make learning participatory with the approach to help. Okay, so as we know, it should not be like a lecture method, it should be a participatory method, so that patient can participate and tell their anxieties and doubts. Facilitator role is another role of a nurse which allows learnings and adopt learners centered approach. So here the learning approach should be learner centered approach. We have to analyze the patient's ability of learning and we have to plan the education as per that. Okay, so next is nurse shall use innovative ways and style in making the patient education acceptable and long lasting effects. Okay, so this is basically like a normal classroom teaching where we use different materials, different methods so that we can make a particular lecture more understanding. So here nurses should use like we can use charts, we can use videos, video lectures, we can use demonstrations so that patient can learn that particular thing properly, and that should be long lasting. Next role of nurse is nurse shall include patient education so that holistic care is provided. As empower patient will have better compliance to the treatment. Okay, so we have to tell the patient what kind of procedures we are providing, what is the benefit of that, what we are expecting the patient to do in this particular treatment process, so that patient can comply with us and it will help the assistance from the side of patient. And nurse can also bring the patient satisfaction with patient education because the anxieties and doubts can be easily clarified. Okay, so patient will be more happy, the anxieties are less, the doubts are cleared, and even patient will feel included in the treatment and decision making. And the through interactive and participatory patient education, nurse can sensitize the patient towards their responsibility in recovery. So it will also help us to tell the patient like what's their role in their recovery. Okay, how they will help in their recovery, what kind of things, what kind of activities they can do to enhance their recovery. So these are the roles of nurse in patient education. So some other roles are there like helper. We have to be a helper of our patient, we have to assist them and we have to provide them right source of information. Okay, that will benefit them. Next one is the facilitator. We have to be a facilitator, we have to include them in the decision making and we have to make sure that they are following every good thing or every good habits for their health. Next is communicator. As we all know, nurses are the communicator. So here nurses not only guide the patient but they also act as an effective communicator. Okay, they will provide the information to the patient, they will also listen to the patient, they will listen to the anxieties, to the doubts of the patient. Okay, and here we can also adopt different styles and innovative techniques of teaching, whatever the suitable for the patient. Care coordinator. Nurses are care coordinators. By providing health education, this is a part of health holistic nursing care. Okay, so here we can provide care to the patient. As we know, a patient is a unique person. We can find out what is the main issue of the patient, what is the main problem of the patient. It will help us to find out. Okay, and as per that, we can coordinate the care for the patient. And next one is the teacher. As the health educator, nurse is a teacher for the patient in their healthcare settings or in their home care setting. It will help in the promotion of health by utilizing all the resources available, by making sure that we are awareing the patient regarding their health and what kind of habits they have to follow. And we are also including the communities and the families in the education. So what is integrating patient education in nursing process? How we can integrate this particular patient education in the nursing process? So as we all know, nursing process, there are following steps how we will care for the patient, and we have to integrate this patient education in the nursing process. In assessment, how we will integrate it. The first step of nursing process, as we all know, is the assessment. So we can add the patient education at the time of assessment. We can assess the learner's ability at that time. Okay, and by assessing the learner's ability at the time of assessment, we can plan the health education as per that. Next one is diagnosis. So we can use this diagnosis in patient education in diagnosis also. Okay, so in this step, the area of patient education is to identify what kind of care we are going to plan for the patient. What is the problem of the patient? What is the main area of problem, and what we are going to do for the patient. Next one is planning. So planning involves the setting of goals, and as we all know, this is also the part of patient education where we will set a goal and we will try to achieve that goal. Next one is implementation. So in the time of implementation, we can add health education so that we can change the maladaptive behavior to the adaptive behavior. This is the main place where we can use patient education for the betterment of their health, for the health promotion and disease prevention. So here we will implement it, and in the cases of evaluation, we can evaluate whether the goal is met or not, whatever the goal we have set, that is met or not. And if not, we can also assess that there is a need for patient education, there is a need for patient assistance, and we can provide that. So this is how we can integrate patient education in these 5 stages: in the assessment, in the diagnosis, in the planning, in the implementation, and in the evaluation. So what are the steps in patient education in nursing process? So both the steps are almost same, as you can see. Okay, the first step is assessment. In nursing process, we will gather the data related to their health, and here we will assess the learning abilities. In second step, in nursing process, we will make the nursing diagnosis. What are the major problems patient is facing? And here, in patient education, we will find out the area where the patient is lacking knowledge and awareness. Next one is planning. So in nursing process, we will plan various kind of healthcare procedures, various kind of interventions for the patient. And in patient education, we will set the goals, and we will set like how we will achieve that particular goal, what kind of methods we need to do. So that is almost same like the planning. Next one is implementation. So in nursing process, we will implement whatever we have planned. And in patient education, we are also utilizing all the resources and planned methods. And last one is the same step, that is evaluation. Here in nursing process, we will evaluate like whether we have achieved the goal or not, and up to what extent we have achieved the goal. And here in patient education, we are also going to analyze like have we achieved the goal. Okay, is our patient is able to understand what we have told them. So this is the process of nursing process and the patient education. And as you can see, all the steps are almost same, and we are assessing, we are making a diagnosis, we are planning, we are implementing, and we are doing the evaluation at last. So this is all about the patient education, and in this chapter we have talked about the concept, importance of patient education, and how we can integrate this patient education into the nursing process. So we have also talked about the different steps of nursing process and patient education, and how we can integrate them together for the betterment of the patients. So thank you so much, students. This was patient education.